Okay. Um, Ready to start. Well, it's been a long time coming. It's been a long time coming. All right, so I'm going to say I hope I'm audible. I've tried doing this live thing a number of times, and I had to do some test runs. So I really hope that everyone can hear me. You know, yeah, I hope I'm audible. Okay. Oops, I left my jotter at my back, so I'm going to try and pick my jotter very soon. But all right, so this is it. This is where we are, Dr. Max's health support community, right? And yeah, we're here. So I'll run everyone through the idea. So for those of you who don't know, I am Dr. Macx, obviously, right? So I'm Dr. Macx, and this is the launch of my health support community. I'm doing this live stream. Okay. Yeah. So there's that. On my page, you might have noticed some singing, some dancing. I might be confused that what's this guy up to? Well, yeah, I do sing and I dance, but I'm also a doctor, and this is kind of something I've had in mind for a while. I just feel like a lot of people would do well with just having a community to support them through whatever health journey they are. I call it a health journey because most of the things that I'm going to be talking about are things that you can't just fix like that. It's mostly a journey, right? A wellness journey, be it weight loss or whatever it is, hypertension and the likes. It's a journey. That's usually what it is. So yeah, there is that. So I'm trying to hold on a little bit. I'm hoping that people can join the live stream. I hope I did not make any mistake with the link or anything like that, because that would just be devastating. That would be devastating. I'm just praying to God I did not make a mistake with that link or something, because I do expect that people would have joined by now. So I'll just slow down a little bit so that I don't have to do too many recaps. But bottom line is, yes, I'm Dr. Macx, and this is health support community. Like I said, I decided to start this because a lot of people need health information, right? And I realized that there is this trend chasing approach that does not suit health information. You see a flashy headline, something big, and of course it works for a lot of things, because people like jumping on things that are so eye-catching and drastic, things that sound extreme. Like, it usually attracts attention a lot, but it's not exactly good for health, because when you put something up like that, people just take it. Sometimes they don't even watch the real thing and get proper information. So we have a lot of probably unintentional, but a lot of misinformation going around, and then people have questions, they can't easily ask those questions, and that's part of why I decided to do this live stream. Okay, that's part of why I decided to do this live stream. Yeah, so this live stream is going to be a series. It's going to be continuous. That's the idea of the community. It's a community where if you get information, you can actually bring it, and then we'll verify it properly, and then you can know whether or not it's something to run with. So I've not gotten into the details of the community yet. I'm still trying to buy time. For anyone who is watching this after the live stream, yeah, I know you might want to skip ahead through all these parts. Apologies. I'm trying to buy time to make sure that at least one or two people join the live stream so that we can kick off. However, eventually I might just have to go into it like that because honestly, there's a limit to how long I can drag waiting. And since it's on YouTube, they can just scroll back or go back and just watch it from the beginning. So let me not drag this too long. Now, let me pick my jotter. I should not have forgotten it behind me. So let me just, I'll do it professionally without looking weird. Okay, that works also. All right, my jotter. Okay. Yeah, so I think we can start. Okay, so first things first, right? What are you supposed to, what is this group about? There are 4 major things that I have in mind for this group, all right? 4 major things that people in this group would have in common. 4. Number 1, of course, and all of them fall under one type of health journey or the other, right? I keep calling it a health journey, okay? So there are 4 major categories of these health journeys. There are those who are trying to lose weight, all right, on a weight loss journey. There are those who are trying to manage their blood pressure, all right. There are those who are trying to manage their blood sugar, and there are those dealing with mental health struggles, who are trying to navigate how to get some stability in their mental health. All right, and of course, this touches a bit on dating. Now, for some clarity, right? Yes, I will touch a bit on dating, and I'm always going to come from a medical perspective. So this is not usually your typical kind of relationship coach session where I tell you, okay, this is it, this is what you should do, this is not what you should do, this is right, this is wrong. I'm not here to tell you to break up with anybody. That's not really my job. I'm here to tell you what is medically healthy for you, your mental health, even if you are dating, right? So whatever response I'm going to be giving to dating issues will come from a medical standpoint. I want to tell you what will be healthy for you to do. Okay, that's where I'm coming from, guys. I'm not here to scatter anybody's relationship, so I just have to drop that disclaimer. All right, so those are the major things. The health journeys that people will have in common. Like I said, weight loss, managing your blood pressure, managing your blood sugar, and then mental health vis-a-vis dating. Okay. Now, one question that someone asked me one time about this group is, oh, okay, if I'm only interested in one thing, do I have to now, sit through all the other conversations that have nothing to do with me, right? So let's say someone is only interested in weight loss. So you are now thinking, must I sit through hypertension classes, diabetes classes, mental health classes? So no. Right? It's not going to work that way. And this is what I mean. First of all these conditions are connected. In fact, maybe I should first start by saying that we're not going to be having separate classes. Oh, this is for hypertension only. Maybe we'll do 15 or 20 minutes. Then we'll now come and say, oh, this one is for high blood pressure. We'll now go and come back. Say this one is for high blood sugar rather. Then come back, this is for mental health. No. Because all these conditions are intertwined, right? They are interconnected, and I'll explain that. Most of the conversations we'll be having apply to one, and also apply to probably 2 or 3 or all 4 of these health journeys. Most of the conversations we'll be having, and look at it, for example, someone dealing with high blood pressure, odds are this person likely has diabetes or is dealing with obesity too, right? And to add to that, someone with high blood pressure, odds are there is a mental health factor responsible for that high blood pressure. Right? There are chances that there's a mental health aspect responsible for the high blood pressure. Okay? So there is that particular aspect, there's that issue to it. Sorry, I keep getting distracted. I'm truly worried that maybe my link didn't take. I'm trying to decide what to do. I just hope that I didn't really mess up my link. I truly hope so. Yeah, I honestly hope so, because I can't see anybody on this live, so I'm worried that maybe. But I think I got the link right. Honestly, I think I did. So let me just continue. Let me just continue. If I find okay, I seem to be having some network issues. I hope it has been fixed right now. Going live is not easy, honestly. So many concerns, so many things to think about. Okay, I think it has been fixed because it's looking normal. Everything has normalized. I'm not getting any funny messages on my screen. Okay, so I'm just going to continue. So these conditions are usually intertwined. So there's a mental health aspect to it, right? Because someone who is mentally drained, mentally fatigued, mentally stressed, right? That person is very likely to have high blood pressure. I remember the story of a patient who was admitted, and patient was admitted because of high blood pressure. He was placed on 2 drugs, it wasn't working. They added a 3rd drug, it still wasn't working. They added a 4th drug, it still wasn't working. This patient's blood pressure was still not coming down, was still very high. And then all of a sudden, a nurse who was on duty at night found out that this man, all through the night, will be calling and asking questions about his containers on the high seas. And then as they dropped the container, so the nurse caught him and was like, wow, we're here trying to control your blood pressure and all you are concerned about is your containers on the high seas. So here the nurse reported him, of course, to the consultant in the morning, and then the consultant instructed that he, drop his phones. In fact, he agreed to drop his phones. All phones were collected from him, and and then decided to just see how it would go. In less than a day or two, they brought his drugs down from 5 to about 3, because the blood pressure was getting well controlled. Eventually, the man was discharged with just 2 drugs for the blood pressure. This is someone who was on 5 drugs, but because he was concerned, so there's the mental health aspect, persistently worrying, about things. It has an impact on your mental health, which will have an impact on your blood pressure. So they are intertwined, like I keep saying, they are interconnected. So it's very, very important. It's very, very important that you understand. Same thing, someone with obesity who needs to lose weight is likely going to have high blood pressure, high blood sugar. They are intertwined. Someone dealing with mental health issues, depression or anxiety, both of them have been directly linked to hypertension. Depression has been linked to overeating, right? Anxiety also linked to overeating, can lead to obesity, can lead to diabetes. So odds are, even if you think it's only one of these health journeys that matter to you, most times you need to look out, be careful, check if there is some other aspect of these health journeys that just might apply to you. If you are trying to lose weight, you should also be checking your blood pressure and your blood sugar, and then there's also a mental health assessment, to know if you have depression, if you have anxiety. A lot of people don't know that they have anxiety. They have no idea that they have anxiety, anxiety disorder. So it's important that you assess yourself, and that's one of the things that we will be doing on this channel. That's one of the things that we'll be doing, giving you tools, and then what working together with you to assess yourself, to know, is it just high blood pressure? Is there anxiety involved? Mental health. Someone said, please look at us in the camera. Oh, where's the camera? Oh, this is the camera. Okay, this is the camera. All right, my bad. I didn't even know. I was just looking at my phone screen. Okay, thank you for that. So I was looking away. All right. So usually they are intertwined. And then another thing is the strategies you will take to lose weight. Most of the time, they will help with your mental health. Most of the time, they will help with your blood sugar and your blood pressure. So typically, a lot of times, the strategies. Now, wow, this is better. Thank you very much, better. All right. So the strategies you will take to do all these things, most times they are very, very closely related. All right. And let's not forget the dating aspect, right? If you're having issues in your relationship life, there is just no way you will not have problems with your mental health, your blood pressure, and most likely your weight. In fact, one of the biggest symptoms of stress in women is that they start to gain weight. For men, it's usually the opposite, right? When men are stressed, they usually start looking slimmer. And for some women too, they start looking slimmer, they look like they've lost weight and all that. For a lot of women, when they are stressed, they start gaining weight. Yeah, better. Okay, so, better, don't worry, your dating life, we'll get to that when we get to that. There are a lot of comments. So when a lot of women are stressed, they gain weight. So that's also something. So you see someone who is having problems in her relationship, also trying to lose weight, not knowing that the problem actually is the relationship she is in. That's why I said I'm not going to tell you to dump anybody or to break anybody's heart, right? But I will tell you that if you are struggling to lose weight, you've been running around trying to do everything, you've tried this tea, these so-called teas, right? You've tried them, you've tried exercising and all that, you're not seeing results. Check your life. Is somebody stressing you? Honestly, check it, right? All these things are intertwined. Till you leave that boy that is stressing you or that girl that is stressing you, right? You might not see any results in your weight loss journey. So bottom line of what I've been saying is that a lot of these things are intertwined and the strategies are often the same, or when you fix one, it starts to ripple across all the other parts of your health journey. So there's that. Okay, so and there are two things that we have in mind. There are two things that we have in mind concerning the approach to all these things. Like I said, weight loss, blood pressure management, blood sugar management, mental health, and dating issues, right? There are two approaches we'll be taking in this community to help everyone. This is not a community where we just talk and talk. It's not just health talk. I will actually help you, like, do the things that you need to do. All right. So the first one is community. The fact that you have a group to support you. And I'll go into details about how this community would actually help you later on. Like, it's not going to be a passive community, right? So I'll go into details about how this community will help you with whatever your health journey is. There is a plan on ground for that, so I'm coming to that. However, another one is exercise, right? You see, everything I've just mentioned, from weight loss to sugar to hypertension to whatever you want to think about, everything I've mentioned, exercise is a big part. And so one thing I have in store for you today is I want to tell you 10 things you don't know about exercise. 10 shocking things that a lot of people, a lot of you do not know about exercise. And like I said, it cuts across everything that anyone might be interested in regarding this community, from weight loss to blood sugar to blood pressure to mental health, exercise. And I'll be telling you 10 things you don't know about exercise. So I'm coming to that now. So sorry guys, I had a network glitch there. So I'll be telling you what exactly to expect from this community. What should you expect? Why are you here? What are you going to benefit? I'm going to be explaining it to you. First of all, weekly Q&A sessions. Any question that comes to your mind, that's part of why I'm here. A lot of people get diagnosed, maybe they're dealing with high blood pressure, high blood sugar, they feel they have some mental health issues. I was recently talking to someone who truly thought that she was crazy. She actually believed, she said that something is wrong with me, I'm not normal. Those were her words. And I had to ask, okay, why do you think something is wrong with you? What are you feeling? She said sometimes she's just jumpy, like she's just paranoid. Sometimes she would just burst out crying and she doesn't even know why. And she thought that, in fact, in her words, she's not normal. And I told her, it sounds a lot like you just have an anxiety disorder. Like, it's one of the, I don't want to say the easiest medical conditions to treat, but it's very treatable. She had no clue. She said she had gone to the hospital, the doctor had said this, had said that, and blah, blah, blah. The doctor did not mention to her about anxiety disorder, right? So, bottom line is, I believe if she had a platform like this, which is one of the reasons why I created this platform, where she could just ask, okay, if someone is feeling like this and this and this and this, what could be wrong with that person? If she had a platform like this to ask, then she would not think she was crazy. Because this is how people feel, and they get frustrated, and people can start having suicidal ideations, right? They start feeling like, look, I think maybe something is just wrong with me, I need to just off myself, all right? So that's one of the reasons why this platform is here. If you have any questions, some people get diagnosed with hypertension, someone tells them, oh, your blood sugar is high, they don't know what next to do, they don't know what questions to ask, they don't know what step to take next. That is why this platform was created. All right, so Q&A sessions, we'll be having that every week, where you can ask me any question on your mind. Secondly, we would also be having information. So I would curate information that applies to all 4 aspects, from weight loss to diabetes to hypertension to mental health. I would always be giving you professional, up-to-date, relevant information that can actually help you. All right, that's part of why this is created. So every week, like today, the plan is to tell you 10 shocking things that you don't know about exercise. So that is what I have for you today, and it will help everybody, right? So we would have those sessions too every week. Third is daily reminders. So a lot of people know what to do. They know, but they just forget because, well, life happens, right? Yeah, life happens. So they forget that I'm supposed to do this or do that, or, nobody to remind them. So one of the things our community would do is give you daily reminders on things you are meant to do for your mental health, so that as you go through the week, you don't stray away. That's one of the things that happens with health talk, right? You go in, you give a health talk, somebody hears it, they feel, oh yeah, I'm going to do this, I'm going to do that. By Tuesday or Wednesday, work has carried everything from their mind. It's just the reality. So that constant daily reminder on activities you need to do, things you need to check, steps you need to take, you will be giving that daily. It might not start off right away, but we'll be implementing it as we have our series, and I'm coming to that. Okay, so daily reminders. Like I said, this is a place where the community wants to work with you through your journey. All right, we want to work with you through your journey. It's not just a case of telling you, the way you go and see a doctor, all right, and doctor says, oh yeah, take this drug, take this, do this, bye bye, and then you go see me in 1 month or 2 months or 3 months, and then you are all alone, right? That's where we come in. And now the doctor has said his own, right? Then you come in, and then there are people here who will work with you through it. And also, imagine you have a question, and the doctor told you see me in 2 months. And you are thinking of how you have to wait for 2 months before you can go and ask that doctor the question on your mind. You're also considering the stress, and you get to a hospital and then you have to wait 4 hours just because you had a question on your mind. It's not encouraging at all. All right, that's part of why this platform is here. Yeah. So I'm intentionally spelling out everything that I expect you to gain from this platform, so that you can see it and see the one that truly resonates with you. All right, so just walk with me here. Next is, we'll be giving a lot of tips. Now, when it comes to exercise and dieting and weight loss, and managing your blood pressure and all that, people need tips of things that they can just apply in their lives very easily. So like dieting tips, we'll be having live exercise sessions. All right, live exercise sessions where it's not just telling you go and exercise. That's what you will hear, right? Nobody's telling you which kind of exercise to do, how long you should exercise for. What Nobody's telling you anything. They just tell you go and exercise. So we'll be having those live exercise sessions here. Okay. At some point we'll probably even do a hangout, a group hangout. That also would help with mental health. Remember, part of the reason why this is a group is to support people. Some people are dealing with loneliness and depression. Just having a community around them to support them goes a long way. All right. So dealing with loneliness, depression, mental health, just having this community. So we would have hangouts sometimes, and just chill out, have conversations about issues and things like that. That's something else you can expect from this group. Another big thing that you can expect from this group is what I call accountability buddies. So you are trying to lose weight and you've told yourself, I want to start doing this. Who is holding you accountable? Who is going to make sure that you do the things that you have made up your mind to do? Because if there's nobody, you just forget. And then you remember after another, like maybe 2 weeks, 3 weeks, you can't be consistent. So we're going to be having accountability bodies, people who hold you to account to say that thing you said you would do, have you done it today? Have you done it? People who would, like I said, we're here to work with each other, all right, on this journey. So accountability bodies, and it's going to be part of our group support. Yeah. And I'm going to explain later in detail how we go about the accountability bodies. I'm going to explain in detail how we go about that. It's going to be a situation whereby it's one-on-one accountability, right? Someone will actually message you to check on you. And I would advise that please, for the accountability bodies, if you're supposed to check on someone or someone is supposed to check on you, please meet them where they are. Not everybody might want you to call them. Don't disturb anybody's day. But I'll go into detail about that when the time comes. Okay. Now, I must give some warnings, all right? Some group rules, some community rules, so that we're on the same page. All right. First of all, this is a safe space. A lot of people here are dealing with mental health issues. They are dealing with depression, with anxiety. They are struggling on their health journey. So it's important that we are patient with people, that we are polite, that we are calm in our approach to people. I haven't opened the group yet because I have not explained this. I will open the group from time to time for specific reasons so that it's not overwhelmed. All right, before someone starts selling shoe and selling bag and rice and beans on the group, all right, and that's why the group is not meant for that. All right, but it's important for me to state this is a safe space. No attacking of anybody, nothing like that. You don't know where someone is mentally, so you don't want to attack them. Very, very important. Also, another community rule: you are not here to sell anything, right? Don't sell anything on the group. All right. So far, I haven't sold anything. So yeah. So you are not here to sell anything. Don't sell anything on the group. Thirdly, no posting of unverified information. So I open the group, then you go and look for, you take caustic soda and mix it with vegetable, and then you mix it with tomato paste and drink it. You will lose weight in 2 days. Don't put that on the group, right? Do not mislead people. Any information you want to share, if you're not sure, ask in the Q&A. You can ask in the comment section. And I forgot to say, please feel free to introduce yourself in the comment section. Oh my, I was supposed to say that at the beginning. Feel free to introduce yourself in the comment section, and you can put what health journey you are on. If it's weight loss, if it's managing your blood pressure, managing your blood sugar, or mental health, dating issues. Please introduce yourself and put it in the comment section. Put your health journey in the comment section. I was supposed to say that at the very beginning. I forgot. Sorry about that. So no posting of unverified information. You can ask in the Q&A, right? You can even ask now if you have any information that you heard you are not sure about. It's better you ask in the comment section during these live meetings than for you to come back, just go on the group and post caustic soda with tomato helps you to lose weight in 2 days. Please, let's Let's be guided. Okay. Another thing is, I cannot consult for anybody. I won't be able to, consult you and prescribe drugs. Why? Because I can't take a proper history. All right. This is an open forum. So, a consultation that focuses on you and your medical history so that I can prescribe drugs. I can't do that here, obviously, because you won't really be ready to open up completely since there's no confidentiality. This is an open platform. So this is not going to be like, oh, you, what did they do you? Fever, headache, go treat malaria, take this drug. It can't work. You can't do like we're selling rice and beans or clothes, right? So that will not work. So I can answer questions, all right? Ask me any questions. Now, every week you will get a homework, a sort of assignment, something that you should work on based on whatever we have discussed, right? And your accountability body will check on you to make sure you do it. It is typically going to be something that will help you, all right? Again, the focus in help is helping you walk through that journey. That is the focus. All right, so every week we'll be getting that. So yeah, get ready. So now we'll be having a series of sessions. Part of what we'll be doing here, I'm just listing out everything because I really want you to see what you resonate with. So part of what we'll be doing here is we'll be having a series of sessions to help you, first of all, understand your journey, right? And then know how to move, right? Know what your next steps should be. So we'll be having a series of sessions to help you properly understand. And what do I mean by understand? Some people feel, oh yes, I have high blood pressure, I have hypertension, and then I just take drugs. Says who? How do you know? Right? Do you truly understand what it means? Do you truly understand how to check if you have high blood pressure? Right? I'll give you another example. I know people who were misdiagnosed, right? Yes, they had high blood pressure. But then when they went to the hospital, and this is someone I know personally, went to the hospital, they gave him drugs for high blood pressure and all that, it wasn't working. So they were about to set him up to see a specialist and, do all the works, just bring in the whole thing since he wasn't responding. And then one of the doctors decided to ask some questions about anxiety and realized that this person has an anxiety disorder. It's not just hypertension. If you do not treat that anxiety disorder, that blood pressure will never come down. And so what did they do? Instead of prescribing blood pressure drugs, they tried to treat the anxiety disorder and the blood pressure came down. Something that they were struggling with, right? So sometimes people don't know. And because a lot of our doctors are overwhelmed, there are so many patients, a lot of them are not taking enough time. So sometimes you truly need to understand, is it truly that you are hypertensive? Is it truly that you are obese or you are overeating because of depression? You are overeating because of mental health issues. You truly need to understand the real issue and then you will know the step forward. So we're going to be going through a series of sessions to properly put all of this in perspective for everyone. You'll be able to do it by yourself. All right, that's the goal of this. Now, so we'll be having, there are three main aspects for that. There will be the know your numbers aspect, or know your mental health. Know your numbers, if it's weight loss, if it's blood pressure, how do you actually check to get the correct numbers, to know where you are right now. Okay, mental health, to also know where you are right now in your mental health. There's that, we're going to have that session. Then the next session we'll be having is setting your goals, right? What are the health goals that you now have? If your blood pressure is high, what is your target? If you're trying to lose weight, what should your target be? All right, so setting those goals, putting them in perspective, and then we'll now start with next steps. So what are you now supposed to do? So we're going to be having all that clearly spelled out so that you can walk through the journey. Okay, so I think I have properly documented and explained extensively what this group is going to be about, and I hope that something has resonated with you. Now, I told you I was going to tell you 10 shocking things you don't know about exercise. That's our main thing for today. I wanted to start with know your numbers today to help everybody know where they are, but I want us to build a bit more community so that I don't have to do too many recaps. That's why I decided to come up with this instead. 10 shocking things that you don't know about exercise. 10 shocking things you don't know about exercise. most likely from next week we'll start knowing your numbers and how to assess where you are health-wise. Where are you right now health-wise? We'll probably start that next week. But right now, we're going to start with 10 shocking things you don't know about exercise. Number one, the CDC has said that the minimum acceptable amount of exercise for an adult is 150 minutes. Okay, we'll see. Bethel is saying that she knows 3 of them already. We shall see. The CDC has said that the minimum amount of exercise for an average adult is 150 minutes of active physical activity, all right, energetic physical activity per week. 150 minutes. In other words, that's at least 30 minutes per day times 5 days. And when I say active, like you are physically engaged fully, right? You are jogging, you are running, you are doing your brisk walking, or you are swimming, or you are cycling, or you are hiking, whichever one it says, 150 minutes per week. Guess what? Up to 50% of people do not meet that minimum requirement. That is the minimum requirement, mind you. It's not the maximum, it's the minimum. Up to 50% of people don't meet that. So my question to you, do you meet that minimum requirement? Answer in the comment section. Do you meet that minimum requirement? 30 minutes per day, 5 days a week of active physical activity. Do you meet that requirement? Not just strolling around, like I've said. Walking, running, jogging, cycling, swimming, hiking. Alright? So, 150 minutes. If you don't, please, you need to start. It's the minimum requirement by the CDC. Alright? 2. Bethel, I did not see your response. I want to see the anyway. Please leave your comments, leave your response in the comment section if you meet that requirement. 2. Longer duration or higher intensity does not necessarily improve outcome as well as frequency. I'll take that again. When it comes to exercise, whatever outcome you have in mind, Bethel says you know the next one. Okay, keep trying. When it comes to frequency, whatever so when it comes to exercise, whatever outcome you have in mind, intensity or longer duration does not guarantee that outcome as well as frequency. In other words, if you decide that, I want to pick one Saturday in a week, where I'll go to the gym, I'll sweat it out, I'll carry everything carryable, I'll do all the aerobics, I'll do everything, I'll spend 5 hours in the gym. You are worse than someone who just does 10 minutes exercise per day. That person who does 10 minutes exercise per day is far better than you, who will take the whole of Saturday in the gym, carrying God knows what, right? Frequency, when it comes to exercise, whatever your goal is, whether it's for weight loss, your sugar, your blood pressure, mental health, whatever, and I'll tell you how exercise impacts your mental health. I always like to make sure I carry them along. All right? So whatever your goal is, frequency is king. Frequency comes first. How frequently can you do it? If you can't do it frequently, trust me, you won't see results. That is just the truth about exercise. It's one of the reasons why exercise is probably the hardest way to lose weight, because you would have to do a lot regularly. All right? I'm happy for you, Bethel. So Bethel said she knew the last one I said. Okay, so that's 1 for 1. Okay. Next, spot reduction is a myth. In other words, when you say, I don't really want to lose weight, I just want to lose weight in my abdomen. I just want to lose weight in my thighs. I just want to lose weight around my face, or whatever it is a myth. You cannot reduce. In fact, doing crunches, which one is crunches? I think that's sit-ups. I've forgotten crunches. Doing crunches to lose abdominal fat is a lie. If someone tells you that this is the exercise you should do to lose abdominal fat, that person is lying to you. It does not exist. You cannot target one part of your body and say, I want to lose exercise in this part of my body. Right? You have to lose weight all over. Yes, better, you are right. You have to lose weight all over. So bottom line is, okay, fine. So bottom line is sports reduction is a myth, all right? You cannot lose weight in one particular part. And this is very common for ladies who say, I want to lose belly fat, right? Now, I will tell you something about belly fat, so just relax, all right? Next is exercise actually releases chemicals in your brain that improves your mood. And do you know, this one now I'm being specific, do you know that smiling like this, right? Nothing is funny. Nothing is funny, right? I'm just smiling like this. Do you know that my brain is convinced to release hormones that make me happy just because I'm smiling? And these hormones improve your mood. Guess what? Not just that, it helps to treat depression and anxiety because I'm smiling like this. Fake smile. What's that? Depression can't catch a moving target. Okay, better. Alright, so just because I'm smiling like this. So guess what? I would prescribe for anyone dealing with depression and anxiety, fake smile. Yeah, you don't need to, I'm not talking of fake smile for people outside, people who don't know you, people who you're trying to please them. No. Fake smile as a type of exercise. Yeah, and you might think you are crazy for a while, but it will actually improve your mood, especially with managing depression and to help you calm down, managing your anxiety, all right? And then, of course, not just that, actual physical exercise, the aerobic exercises and all that, awesome in helping you manage your, in helping you improve your mood, all right? So that's one key one. Another one is exercise improves your memory. Yes, so if you've ever dealt with people who, especially elderly people, right, they can't recognize anyone, right? You know, all of a sudden they find themselves somewhere, they don't know how they got there, or they are seeing someone and they are calling the person the name of someone else, right? It's not in the dark now. They can see the person in broad daylight and they are saying someone else's name to that person, like they believe this is someone else. All of them have to do with memory issues, all right? And exercise is one of the ways to prevent that, all right? Exercise improves your memory. So if you don't want to get to your old age and you can't recognize anybody, one of the things you should really be strongly doing is exercise. Really, really helps with your memory. Next, so I have already spoken on exercise for your brain, which is the smiling that I talk about. So, but also the physical exercise, running around and all that, it improves so I think I merged two of my points together. So there's that. All right, next is, did you know that exercise actually prevents and also treats erectile dysfunction? Yes, it is one of the treatments for erectile dysfunction. Men who are unable to perform their duties with their wives. And how do you know that the statistics for erectile dysfunction are quite surprising? Up to 5 in 10 men in Nigeria have erectile dysfunction. And guess what? Some major things have been linked to it. Hypertension, diabetes, anxiety. These are all things that have been linked to erectile dysfunction. What helps them? Exercise. All right, exercise. So you can see how it touches everywhere, right? Exercise is very, very important. So yes, exercise helps to prevent and to improve the recovery from erectile dysfunction. Next is for people trying to lose abdominal fats. All right. This one actually, when I found out, I was like, oh yeah, I'm going to share it with everybody. If you're trying to lose abdominal fat, one of the things that you need to do is increase the ability of your body to burn calories. All right, you need to increase the ability of your body to burn calories. When you eat food, that food is converted into calories. The excess calories are stored in your abdomen as abdominal fat, belly fat. So one of the things that you need to do is increase the ability of your body to burn calories. How do you do that? Strength training. Yes. So even you as a woman should be carrying weight. Yes, it helps with reducing your abdominal fat. It doesn't just target your abdominal fat, mind you, but because you are doing strength training, you now have muscles, and muscles burn calories a whole lot more than fat cells. All right. So because you have muscles, when you eat, those calories are quickly mopped up by muscles, and that reduces the rate at which your abdomen is getting bigger. Also make sure that when you are doing your exercise, especially, okay, I'll get to that, but when you're doing your exercise, what happens is that those excess fats will be released into the bloodstream as sugar, and then your muscles, all right, because you have done strength training, your muscles can mop all that sugar up. So it also aids the process of burning belly fat. So you want to lower your belly fat, pick up some strength training, go to the gym, carry some weight to help you. Next is speed walking. So for those who cannot run, cannot jog, cannot cycle, cannot swim, which is actually me, right? I can't do a lot of those things. Jogging made me nearly pass out. We go with speed walking, all right? Walking very, very fast. Speed walking. Now, speed walking is very, very useful. It's also called brisk walking, all right? It is very useful to burn calories, to lose weight and all that, and also for your mental health. And while speed walking, it has been discovered that you should not swing your arms, all right? Just keep your arms down and just keep walking as fast as you can, all right? So speed walking with your arms down is a very, very good form of exercise, all right? And this is especially good for people who are just starting their weight loss journey, all right? It's very, very useful. Next, if you want to maximize the impact of your exercise, especially if you are thinking of weight loss, all right, and you just want to get the most out of your exercise, either you exercise on an empty stomach, right? You exercise on an empty stomach, or you exercise up to 4 hours after eating. If you want to maximize it, you want to exercise up to 4 hours after your last meal. Why? If you exercise on an empty stomach, then your body needs energy, right? Where will it go? Because there's no food in your stomach to give calories, it will go to your fat, all right? Your body fat, your belly fat, and all that. It will start burning them for energy. But if you eat now and you just start exercising, the body will just start using the energy from the food you are eating, or from the food you just finished eating, right? It's not burning anything. And then on the other hand, if you could wait 4 hours, then that food has digested, calories have gone in, and then the body can now focus a bit more on burning fat cells around your body. All right. So either you exercise on an empty stomach, or you exercise up to 4 hours after eating to maximize your results. Okay. Oh, that was my number 10. All right, now there's one other section, and please feel free to ask questions in the comment section. Even after this live stream, you can ask your questions. I'll answer in the comment section, or I'll peg it down for my next live stream. All right. Now, the final session for today, right? Bad habits to change. Bad health habits to change. I'm going to be telling you one bad habit you must work on every week. One bad habit. And this one is quite common. You see those people that you want to take your bath, right? If you want to take your bath, then you tie the towel and walk around the whole house with that body that you are supposed to wash. You are tying the towel that you are going to use, right? And you walk around, then you go and take your bath, and then you pick up that same towel to clean yourself. Bro, no, you cannot do that. All right, you have almost defeated the purpose of taking your bath. You just use the same towel that you put on yourself while your body was not clean, and you are using to rub yourself again. So when you start developing rashes and things like that, you'll be wondering why. This is one of the reasons. All right, so if you have two towels, you can have one that you tie before going to the bathroom, and then one you use afterwards, right? So that we separate them. Okay, so please don't do that. If you just don't do that, all right? Or you don't use any towel at all before entering the bathroom. Use your towel after, taking your bath. Okay, so I hope this was insightful for someone out there. Like I said, the community has opened up. Leave your questions in the comment section. Introduce yourself and let us know what health journey you are on, and we will definitely pick things up. Things that off to a bit of a slow start. Some people eventually join my live. Thank you, Bethel, and some other people who joined my live, but they didn't leave any comments, so I couldn't really identify them. But please, thank you all so much. Feel free to share this community with anyone. This is information that would help a lot of people, right? A lot of people. So feel free to share with people who might be on a similar health journey, and let's just get everybody together. Let's educate people, and let's help prevent what we can prevent, right? That's one of the importances. That's one of the, what am I saying? Sorry. That's a major importance of this education, all right? So, till I see you next time, I've not started the daily reminders and all that. Things will pick up little by little, but for now, I think it probably would be till next week Sunday. Like I said, please leave your questions in the comment section below. All right, just leave your questions and I will attend to all of them. I'm Dr. Macx, and it's been a pleasure having this conversation with you. Let's see what we have in store for next week, right? Please, if you didn't start this from beginning, go and start from like 05 minutes, because before that I was just introducing myself, so you can start from 05 minutes. Thank you all so much. It's been a pleasure. Have a wonderful week ahead, and stay good, stay healthy. Dr. Macx out.